want to talk more about the health care debate that's at the center of this government shutdown. So joining us now is the Centers for Medicare and Medicaid Services reporter, Robert King. Robert, thanks for joining us this morning.
Thanks for having me.
Yeah, so there are two health insurance issues that Democrats want to address. I want to start with the tax credits for people who get insurance through the Affordable Care Act. They've been in place for a few years, set to expire at the end of the year. How big of a deal is this for people? How much more expensive will insurance be if these tax credits don't get extended?
Sure. So these are enhanced tax credits that were passed in 2021 by Congress. And they really boosted savings for Americans that got coverage through Obamacare's insurance markets. There is an analysis from the think tank KFF that said that premiums, if the tax credits expire, will increase from an average of $888 this year to about $1,900 next year. So that's a pretty big hike.
Yeah, that's massive.
And you think about where people are at right now in terms of just inflation and grocery price and everything else to add that in. So I know Democrats also want government funding to reverse Medicaid cuts. If there are no changes, millions are actually expected to just lose coverage altogether. Is there any hope for major changes here?
Not really. I think that what I've seen is that congressional Republicans, some of them are open to an extension of the Obamacare subsidies, but they don't want to negotiate now. They want to negotiate when the government is open. But they're not going to roll back the Medicaid changes that were just passed in July as the One Big Beautiful Bill Act, which was President Trump's biggest domestic policy accomplishment.
Yeah, and you brought up why we made it to this government shutdown, because Republicans are saying this doesn't need to be negotiated now. Democrats insist that a government funding bill needs to include these health care issues. Why are Democrats so insistent this happen now?
Well, partly is because of timing. The open enrollment for Obamacare plan starts on November 1st. And Democrats are pushed, especially by their base, to kind of address this issue now and to also fight Republicans and President Trump's administration, especially over issues such as government rescissions and funding fights that have happened previously, and layoffs as well.
Okay. I know both of these parties seem pretty locked into their stances, but when you start going out to constituents and talking to people and seeing some of the polling numbers of what people are looking at, it looks like the majority of Americans do want some type of provision in there to see these these healthcare options extended. I was listening this morning to some reporting that said that some Democrats are willing to maybe pass this funding bill and then negotiate later, as long as they get specific information from Republicans on timing and how that will work. Do you think that could happen?
I think so. I think that right now we're looking for, Democrats could be potentially looking for off-ramps for the shutdown. I don't think that either side wants the shutdown to be very protracted and long. There is apparently a group of low-profile Senate Republicans that are actually crafting a conservative proposal for extending the expiring subsidies. So I could see something like that happening. But Democrats are going to definitely want some type of commitment to address these subsidies, and soon.
Yeah, and they're holding firm on that. Robert King, thank you so much for being with us this morning.
Thanks.
And stay with Kate.